Benign prostatic hyperplasia, BPH, is one of the most prevalent conditions affecting men as they age. While BPH is not cancerous, the symptoms associated with it can severely impact the quality of life for those who suffer from it. The prostate is a walnut-sized gland that forms part of the male reproductive system, located beneath the bladder and surrounding the urethra. As men age, the prostate tends to enlarge, placing pressure on the urethra, which can lead to a wide range of urinary problems. In some cases, BPH can significantly interfere with daily life, and early treatment is essential to reduce the impact it has. Although BPH is not a life-threatening condition like cancer, it can still cause considerable discomfort. The enlargement of the prostate obstructs the normal flow of urine, and as the obstruction increases, the symptoms become more noticeable. Here are the main symptoms of BPH and how they affect men's lives. One of the first signs that men may notice when developing BPH is an increased frequency of urination. This means the person feels the need to urinate more often than usual, even without consuming large amounts of liquids. Urinary urgency, the sudden need to urinate, is also a very common symptom. It can occur at any time of the day but is particularly prevalent at night, a condition known as nocturia. Nocturia can disrupt sleep, leading to chronic fatigue. Men with BPH may wake up multiple times during the night, which can not only affect their rest, but also their physical and emotional well-being during the day. Another typical symptom of BPH is difficulty in starting urination. Many men with BPH experience what is known as urinary straining, where they feel they need to exert extra effort to start urinating. The enlarged prostate compresses the urethra, making it harder for urine to flow freely. This may require significant effort, and the man may feel a sensation of blockage or the inability to fully empty his bladder. This symptom can be particularly frustrating, especially when it occurs suddenly, making urination difficult and uncomfortable. The urine stream may become weak due to the pressure exerted by the enlarged prostate on the urethra. As a result, the urine does not flow with the same force as before, leading to a weak stream, or even interruptions in the flow, requiring extra effort. At the end of urination, some men experience post-micturition dribbling, where small amounts of urine remain after they have finished urinating. This can be uncomfortable as a sensation of discomfort lingers even after the bladder has been partially emptied. Interrupted urination is another common symptom of BPH. Men with BPH often report that their urine stream stops and starts several times during urination, making it difficult to urinate continuously. This happens because the enlarged prostate causes blockages in the urethra, which disrupts the normal flow of urine. Not only is this inconvenient, but it can also make the individual feel as though they have not fully emptied their bladder, leading to the need to urinate more frequently. Nocturia is the medical term for the need to urinate repeatedly during the night. Men with BPH often wake up multiple times throughout the night due to the urgency to urinate. This interrupts their sleep cycle, leading to fatigue and exhaustion during the day. Nocturia occurs when the enlarged prostate prevents the bladder from fully emptying, resulting in a constant feeling of needing to urinate. This symptom can be particularly debilitating, as insufficient sleep affects overall health, mental clarity, and work performance. In more severe cases, BPH can lead to urinary incontinence, the involuntary loss of urine. This occurs because the pressure on the urethra becomes so high that the bladder cannot effectively hold urine. Incontinence can be particularly problematic if the person loses control at inconvenient or public times, leading to embarrassment, reduced self-esteem, and general discomfort. In some cases, incontinence can be painful if the bladder becomes overfilled or distended due to urine retention. Prostate enlargement affects not only urination but also sexual function. Many men with BPH experience pain or discomfort after ejaculation. This can happen due to the pressure the prostate exerts on the reproductive glands and vas deferens, leading to discomfort or pain in the lower abdomen. In some cases, the pain can become chronic and may intensify during or after sexual activity. This symptom can lead to frustration and decreased quality of life, particularly in terms of sexual health and intimate relationships. Painful urination, also known as dysuria, is another symptom commonly associated with BPH. The pressure on the urethra caused by an enlarged prostate can lead to a burning sensation or pain during urination. This pain may be constant or intermittent and could be accompanied by a persistent discomfort. Inflammation of the prostate can further exacerbate this pain, making the act of urinating a painful and unpleasant experience. The main cause of BPH is a benign enlargement of prostate cells, a result of age-related hormonal changes. As men get older, there is an increase in the production of dihydrotestosterone DHT, a hormone that plays a key role in the growth of the prostate. Although BPH is not linked to prostate cancer, the enlargement of the prostate can create obstructions in the urethra, leading to difficulty in fully emptying the bladder. This obstruction causes the urinary symptoms described above, which significantly impact the daily life of those affected. The treatment for BPH depends on the severity of the symptoms and the patient's general health. In mild cases, lifestyle changes such as avoiding fluids before bedtime, exercising regularly, and following a balanced diet can significantly relieve symptoms. Additionally, medications like alpha blockers, which relax the muscles of the prostate and bladder, and 5-alpha reductase inhibitors, which reduce the size of the prostate, are commonly used. In more advanced cases, where medications do not provide relief, surgical procedures may be necessary. Transurethral resection of the prostate, TURP, is a common procedure performed to alleviate urinary obstruction by removing excess prostate tissue. In some cases, a prostatectomy, which involves partial or complete removal of the prostate, may be required. If you have noticed any of these symptoms, it might be worth considering supplements that support prostate health. Click the link in the description below to learn more about a supplement that can help improve your prostate health and alleviate the symptoms of BPH. Early intervention and proper care can significantly improve your quality of life and reduce the impact of BPH on your health and well-being.